Let's talk about the differences between inpatient and outpatient for the Psych and P. The three main differences are the level of care provided, the duration of the treatment, and the types of services provided. We'll start with inpatient. Inpatient is going to be your hospital setting. This is a 24-hour facility, typically a locked facility where you're getting round-the-clock care. You have a nursing day shift and night shift, and they usually have their own room or they may have a roommate. Patients you're going to get inpatient are the patients that need immediate and emergency care. This could be they've been off their medications, they're a danger to themselves, they're a danger to other people, they're pretty much unstable and they're coming inpatient to get stabilized. They could also be inpatient to undergo medical detox off of some substance. So this is for alcohol detox, opioid detox, and any substance abuse that they need to be monitored to come off of. In the outpatient setting, this is your long-term management. So think of this as your primary care for your mental health. This is typically a clinic setting where you have scheduled appointments. You're either seeing your patients weekly, it may be monthly, or every 3 months, depending on how stable the patient is. They may be receiving other services at this clinic, such as therapy, such as working with their case manager, or even primary care services at some of these clinics. Your typical patient stay while inpatient can be days to weeks, depending on how much stabilization they need, or it could even be up to several months if they're there for detox or for sobriety, depending on what type of facility it is. Depending on what kind of facility it is, and they also have some long-term, such as your state hospitals, where patients go to live there, some of them indefinitely. Some of the patients that have been charged in crimes where they were found mentally incompetent will get sent there to live, and that's their residence. So it just depends on what kind of hospital setting, and that will dictate the duration of the actual stay. For both settings, they typically have groups that the patients have to attend. Obviously, the one inpatients, they're more acute and stabilizing, working on immediate coping skills. In the outpatient setting, they also have groups more one-to-one, have support groups, AA meetings, and working on long-term coping strategies. As far as the provider role, the nurse practitioner role, inpatient, you're going to have medications available to you immediately for immediate use, and the goal is to stabilize them and monitor them for side effects and effectiveness while they're there, and then they'll transition on to the outpatient. Outpatient, you're seeing them on a continuous basis and making adjustments slowly as needed, although we do not have PRNs in outpatient settings. So if somebody is in a crisis state, from there they would transition into inpatient. So it really just depends on how stable the patient is, to which services they're going to be providing. But overall, inpatient is for unstable and outpatient is for the generally stable psychiatric patients. For nurse practitioner schedules in either setting, usually inpatient, depending on the facility, they may want you on site. Some let you just do your rounding and go home. It really depends on the facility and their protocols. Outpatient is going to be more of the Monday through Friday type schedule, sometimes 410s. Sometimes they let you work hybrid, which is, some days at home and some days in clinic. So it just really depends on what kind of patients you want to see. If you like to see the more complex, unstable, and getting them stabilized, then inpatient's your go-to. You can work days or night shifts. And then if you're wanting to work more of a regimen schedule, know what your schedule is going to look like throughout the day, then I would recommend the outpatient route. And like I said before, there's so many options in different places that a psych and P can work, and these are just some of the differences between inpatient and outpatient setting.